everybody out in the dark. Yes, I'm going to talk to you today about transport. And I just wanted to start with a lovely heartwarming picture which shows a man helping a lady with her shopping at the train station, helping her to get on the train with her shopping. And it's a picture that I think highlights one of the many lesser known, more intangible benefits of transport for health, which is the collective experience of travelling. Gives us lots of opportunities to give and do nice things for other people, whether it's helping someone with their shopping, like in this picture, or giving up your seat for somebody. And giving to others is recognised as one of the 5 ways to well-being. Public transport, walking and cycling contribute to all 5 of those, although I was a bit dismayed to hear Dr. David Smart earlier say there's now 10 ways to well-being, so I'm going to have to rewrite this presentation at some point. So moving on to the second of my 5 ways, the second one is connect with people around you. So whether that's on the journey itself or at the places that your journey connects you to. A third of people deliberately catch the bus just to have some social contact with other people, which I think is quite a shocking statistic. The third way to well-being, be active. Even simply walking to and from the bus stop every day can provide half of the recommended daily level of exercise. So bus passengers walked an average of 1.3 kilometres when taking a return journey by bus, which is 2.5 times more than doing the same journey by car. The fourth way to well-being, take notice. When we're on the bus, the train, or we're walking or cycling, it allows us time to think and notice the world around us. Research by MindLab found that taking the bus rather than the car can reduce mental stress by 1/3. And finally, keep learning. So bus and train journeys offer the opportunity to read, to catch up with some work, to study, and they also connect people to learning opportunities. And this bus, which is the 36 bus where I'm from in Leeds, it goes between Leeds and Harrogate, and they've gone a stage further by having a library shelf on the bus for people to borrow books from and lend books to. So if public transport walking and cycling can improve people's well-being, what else can it do for health? So in this presentation, I want to outline some of the ways in which transport can support health objectives, and also the ways in which the health sector can help support transport objectives. In other words, why should we work together? And then I'm going to look at to what extent we're working more closely already, and at some of the tools we can use to encourage more collaboration. And then I'm going to look at a specific opportunity for collaboration around healthy streets. But before I do that, I better just say a bit about who we are at Urban Transport Group. So these are our members. We're the UK's network of city region transport authorities, and you can see where we're based around the map there. So we're the UK's largest urban transport authorities brought together as a network, and our job on behalf of our members is to make sure transport plays its full part in making city regions fairer, greener, healthier, more prosperous and happier. And we've done a fair bit of work on health in recent years. We work across the full range of transport topics, but our work on health began around 2013, around the time of the move of public health teams into local authorities. So we published briefings to help our members understand those changes, and we built this web hub here, which is open to everybody and has recently been completely revised and updated, and it gathers together the key resources we think are essential reading for understanding the links between transport and health. And it's also got some tools on there for collaboration that both the health and transport sectors can use. In 2015, we commissioned Dr. Adrian Davis, who's a specialist in both transport and health, which is quite unusual, to survey all directors of public health across England to measure the extent to which their public health teams were collaborating with transport teams. And the resulting report was a healthy relationship, and I'll touch on some of the findings of that later in my presentation. In 2017, we convened a national roundtable between transport and health stakeholders at the British Medical Association, looking at how we might work together to overcome barriers to joint working between our two sectors. And the same year we also produced a report with the Community Transport Association looking at how total transport principles might provide a better approach to commissioning non-emergency patient transport. And again, I'll say a bit more about that later. And now in 2019, we're in the midst of a year of action to promote healthy streets, again, of which more later in my presentation. So that's a very quick summary of our work on health. But now I want to look at the rationale for transport and health working together. What can you do for us? What can we do for you? I'll start with what we can do for you. So this kind of summarises what we feel transport has to offer the health sector. Transport, we believe, is one of the key issues determining whether or not a person leads a healthy lifestyle. We get people moving. Taking public transport, walking, cycling are one of the easiest ways for more people to get more active every day. It's something that can easily be incorporated into daily routines. Swapping short car journeys for active travel could save the NHS £17 billion over 20 years, with benefits after just 2 years for some conditions. We can improve air quality by enabling more people to walk, cycle and use public transport, and by investing in green vehicles. £8 million of air quality damage costs were saved as a result of the 4,000 green buses that were in operation by 2016. Now, there are 32,000 buses across the country in operation. Imagine what impacts on air quality we could have if we greened the entire fleet. We can help build healthy travel habits for life. We need to start early with children, getting them to walk to school, cycle to school. We promote mental well-being, as I've already discussed, and by making roads and vehicles safer, we can cut injuries and fatalities. We also help people to stay independent, transporting people from door to door if necessary. Just one ring and ride bus service serving 31,000 blind and disabled passengers saved the health sector between £13.4 and £58.5 million due to the reduced need for care, avoiding the use of taxis and costly NHS transport, and improved access to employment for those people. We work to ensure that people without a car can access healthcare. There are examples where introducing the right bus service to healthcare locations reduced missed appointments by 60%. We provide the buses, trains, footpaths and cycle lanes that connect people to shops selling healthy and affordable food and to healthy activities. And it doesn't end there. We can apply our transport expertise to help you to save money on the delivery of things like patient transport. So this is the research that we did with the Community Transport Association to explore the potential to save money by taking this total transport approach to delivering non-emergency patient transport. So evidence suggests that currently the commissioning of this kind of transport is not necessarily informed by transport expertise. It's often over-specified and it can result in patients experiencing long and painful journeys. So total transport involves working across sectors, across public policy divides to deliver better outcomes for communities through the sharing of resources and expertise. So it would see patient transport fleets pulled together with social care transport, school transport, community transport under a single pool and under a single point of contact. Many of the local authority vehicles that are in operation at the moment are very well equipped they're kind of got a similar specification as the non-emergency patient transport, particularly, for example, social care transport. So there's a lot of potential there, and there's a lot of unused capacity. That school transport sits unused for large portions of the day. What use can we make of those vehicles? So the total transport approach could help to ensure that the entire public sector vehicle fleet is put to maximum use throughout the day and that the right vehicle is deployed for the right job. And the coordination centre would also have knowledge of the mainstream bus and rail network where that would work better for a person. So in London alone, 37% of patient transport users had missed an appointment due to patient transport in the last 2 years. So if through improving the efficiency of patient transport, even if we just prevented 10% of missed appointments nationally, that could save the NHS 74.5 million a year. So that's a really quick run through of some of the things that transport can do for the health sector, but what can you do for us? You can encourage more people to walk, cycle and use public transport in recognition of the health benefits. That helps us to increase patronage, cut congestion, reduce harmful emissions. And these messages are even more powerful when we work together. So there's a couple of examples there about where transport authorities have teamed up with Public Health England to promote the Active 10 initiative, which encourages adults to build a brisk 10-minute walk into their daily routines. And in the West Midlands, that was promoted alongside cheaper short hop tickets on the bus, with the idea that people could get active by getting off a few stops earlier and do their Active 10. Here's another example. It's a bus in part of Brighton's Take Part Festival of Sport and Activity, which highlights how many steps there are between key destinations in Brighton. The health sector could also help us by encouraging patients, staff, visitors to health facilities to travel more sustainably. So this could be helping to support vital bus connections to hospitals and doctors' surgeries, and investing in schemes to encourage more staff to walk and cycle. Ensuring patients, staff and visitors can reach healthcare using green, sustainable, healthy transport modes is so important. On any one day, NHS-related traffic accounts for 5% of all road traffic in England, and that's the equivalent of driving 1,000 times around the equator every day. So it's a lot of traffic that the NHS is generating. And the Royal College of Physicians has tried to put some figures on the impact of that traffic. And they found that NHS-related traffic is associated with 753 deaths from air pollution, over 8,000 life years lost from air pollution, 85 deaths, 772 major injuries from accidents, and 650 million in NHS expenditure. So it's really important that we work together to reduce the impact of traffic associated with healthcare, and that could be through more efficient use of resources such as total transport, but also by ensuring that healthcare locations can easily be reached on foot, by bike, by public transport. All too often we find that transport authorities are consulted too late in the day when planning the location of healthcare facilities. It's not easy or cheap to retrofit those connections in, so we want to work with you. But most of all, we can help each other by recognising and valuing each other's contribution to one another's outcomes and translating that into some real joined up thinking, collaborative working, joint projects, joint funding. So what extent is that actually happening? I mentioned earlier the research that Dr. Adrian Davis did for us with Directors of Public Health to see the extent to which their teams worked with transport teams since public health teams moved back into local authorities. So we found strong evidence of improved collaboration since that move. So before the move into local government, 15% of Directors of Public Health rated collaboration between health and transport as medium, high or high. And after that shift into local authorities, 61% said collaboration was medium, high or high. So it's a big improvement. But they also identified a number of barriers to joint working, including, of course, lack of funding, but also the perceived cultural dominance of the car, differing standards of evidence between the health and the transport sectors. Other challenges included little involvement of transport in health and wellbeing boards, the fact that transport doesn't yet feature strongly in a lot of local public health plans, and that the health sector aren't consistently involved in transport policy development either. And transport itself struggles to find a way to understand how the health sector works, who to speak to, who the contacts are. So with some of these barriers in mind, and with help from Dr. Adrian Davis, we created 2 companion guides. One's aimed at the transport sector, helping them to understand how the health sector works, and one's aimed at the health sector, helping you guys to understand how transport works. You can find those on our Health and Wellbeing Hub on our website. And the guide for each sector looks at why we should work together, who does what and who to contact, discuss collaboration, key opportunities to get involved in decision making, how investment decisions are made in each sector, the standard of evidence you can expect that sector to work to, information on budgets and ideas also for joint projects and initiatives that we could work on together. So I just want to finish by highlighting one such idea for joint working, which I think presents a great opportunity for health and transport to work together and support each other's policy objectives. And that is to work together to plan and promote urban environments that are informed by healthy streets principles. So many of you have probably come across healthy streets already, but for those who haven't, it's an approach that seeks to prioritise people and their health and put that at the heart of the design of urban environments. And the diagram here shows the 10 indicators of a healthy street. The most important ones there are that everyone feels welcome and that people choose to walk and cycle, because a lot of the other indicators actually rely on getting those two right. I mentioned earlier we're in the midst of a year of action around healthy streets, working with its creator, Lucy Saunders. She's overseen the mainstreaming of this approach in Transport for London's policies, and our year of action is aimed at supporting other cities to adopt the healthy streets approach. So I just want to give you some examples of the difference this can make on some real streets. So here's a before and after picture of a street in Waltham Forest, and this was part of their Mini Holland project. So it's been transformed. You can see on the left a typical street really that you would find anywhere in the country, parked cars everywhere, very narrow pavement, difficult to cross, just not a very attractive space. And the changes they've made have completely transformed it. So you can see that the road is closed to cars between 10 and 8 p.m, 10 a.m. in the morning and 8 p.m. in the evening. The air's cleaner. The roadside car parking has been replaced with places to sit, places to park your bike, plenty of space to walk. The street is easier to cross because it's not clogged up with parked cars, and it's safer. Trees have been planted to provide shade and shelter and also to help clean up the air. So you can see the result. The street looks attractive. It's encouraging people to walk and cycle. You can see a child just running across the centre of it there, which would have been obviously unthinkable before. So it can make a real difference. And here's another very different street with some perhaps more subtle changes. But you can see that the changes have been made. There's a safe place to cross now with that zebra crossing. There's the very narrow cycle lane on the left of the screen there has been replaced by a much wider two-way cycle lane. Plenty of spaces to cross, better wayfinding, there's more signage so that people know where they can walk and where they can get to. So a big difference. And you can see how designing streets with people and their health in mind could really save the NHS millions by getting people active, cleaning up the air, improving mental well-being and reducing accidents. And it's healthy streets, I think, is an excellent opportunity for health and transport partners to work together. And there's loads of resources out there to help. So if you have a look on the Transport for London website, you'll find some of those resources. Although they've been designed by Transport for London, they're actually applicable anywhere really. But one of the actions that we're doing as part of this year of action on healthy streets is trying to translate some of those to a more national context, so including examples of healthy streets across the country, so they're a bit more relatable outside of the capital. And Lucy Saunders, the originator of Healthy Streets, has been running webinars and workshops for our members and their district colleagues in transport and public health to support them to apply the principles to their projects. In West Yorkshire, the result has been the development of proposals for healthy streets in all of the West Yorkshire districts, and both transport and public health officers were involved in designing and developing those. So I'd really encourage you to take a look at those resources and think about how healthy streets might be a way for you to translate the connections between transport and health in a really practical way, and in a way that could have a really transformative effect. So that's the end of my presentation. We've looked at what transport can do for health and vice versa. I think there's an incredibly strong case for more collaboration between our two sectors, and there's evidence that that is actually happening more and more. So I'd like you to think about how transport and health colleagues where you are currently work together, how they can do more, and perhaps Healthy Streets would be a good place to start. And I know we've not got time for questions today, but if you have any questions or comments, please feel free to get in touch in any of these ways or grab me at lunchtime. Thank you.